Let's talk about the teeth in a day model. The teeth in a day model became very popular from a standpoint of marketing, and it came from Brazil, where they do a lot of implant dentistry, and that type of dentistry was pretty novel and pretty risky. You would have never seen this come around through the United States, and you wouldn't have seen it really come around. Probably could have come around through Europe, but because the Brazilian system is not as litigious as what we have in the States, you will have more kind of exploratory type clinical work. And so this all-on-4 or teeth in a day model comes to life. Teeth in a day is probably one of the biggest things I get asked from patients that are looking around for full arch restorations, and I find it to be one of the biggest and strongest marketing tools that dentistry has put out there, for sure. So I think this is one of the best marketing lines that I've ever heard, but there were some prior to that. So back when Listerine came out, they sold Listerine on the idea that it cured something. They tried, oh, it helps bad breath or it helps your cleaner breath and all those things, but people didn't really care until they called bad breath a clinical name called halitosis. So they said, this cures halitosis. And then they said, do you have halitosis? And that meant back in the 50s that people went, oh my God, I think I have that, meaning they have some sort of disease or something. And so through this idea of creating this clinical element to it, Listerine took off. And so halitosis was cured because everybody had it, and essentially they were just doing breath freshener. So that was one of the very first brilliant marketing things that came out of the dental marketing scheme. Another one I like is Oral-B. This is more of a current one where they say brush like a dentist. And I mean, I think that says it all. I think if anybody's out there, they kind of want to do that. Another one I really like is what 1-800-DENTIST does. They're not so popular now because we don't sit there rotary dial and dial in on your phone pad. They're still around, and they are a referral site. And they started with a billboard in Santa Monica allowing people to, hey, I don't have to ask somebody for a referral, but I can ask this 1-800-DENTIST service to find dentists in my area. And it actually worked out really well. They went nationwide and did a great service for patients as well as doctors. And Fred Joyle, the owner, the starting guy of 1-800-DENTIST, wrote a book called Everything is Marketing, and it's a really, really great book for dentists, if there are dentists out there. Now, the last one here is the Clear Choice one, which I call this teeth in a day, or they call it teeth in a day. And it's also called all-on-4. The model, the selling points have to do with a hybrid denture on 4 implants. That's all of the denture, 12 teeth on 4 implants. So that's why it's called all-on-4. But they call it teeth in a day because that's kind of what everybody wants. Like, everybody thinks they want something faster, easier, better, but there's no real healing to implants. So we'll get into that a little bit more. So every dentist already does this teeth in a day. And so when they use teeth in a day, it draws on this insight that people have, that they go, gosh, that'd be great. My teeth are all rotted. I'm tired of this. I'm tired of this. I'm tired of this. How can I fix this? And they say, we'll give it to you in a day. You just pay us a bunch of money. Okay, I could do that. And then they go, here you go. So what if they actually told you what they were doing, and the tagline said this instead? It said denture teeth in a day. This is why every dentist could do this, and every dentist does this. That when you have rotting teeth and you got to have full extractions, we can have a denture made for you, which is what Clear Choice does, or anybody that does teeth in a day model. They have a denture made for you, and basically they'll take your teeth out and put the implants in, and they will give you a denture. So it's basically denture teeth in a day, but if they use that as a marketing line, nobody would find that special. They just leave that one word out of the sentence, and it becomes magical. So I think it's really quite brilliant. So the basic premise of why this works is they have dental implants that they connect to the denture. But this is also the problem why it doesn't work that well, because they're non-healed dental implants fixing the denture to it. So the problem is that a bone healing event occurs and needs to occur over the course of months. So the average dental bone healing event that I call a bone healing event is 3.5 to 4 months. That means that when they initially put those implants in, you want them to integrate, you want the bone to ossify around those implants, fixing the implants in place so that you can add your prosthetic to it. Your hybrid denture, your overbar denture, whatever you want to do, your single tooth, but you got to let it heal. And there's problems when you see immediate implant failure. So there's a couple basic reasons why implants fail out the gate when you place it, meaning within the first month or so. So the very first one that I mentioned, and this is kind of obvious, is that if you get an infection around that wound site or that surgical site. So if you have an infection around an implant site in the initial stages of healing, of course it's going to fail. So that's kind of an obvious one. The second one is micromovement. So if you have any sort of micromovement that goes on, it's kind of like your broken arm. Like if you break your arm, you have a cast that fixes your arm so it doesn't move. Now, if you didn't have that and they just put a bandage on it, your bones would move, and as that movement goes, you would just create cartilage between, or connective tissue between, and the bone won't want to fuse together. It's the same thing with dental implants. If you have a dental implant that is in there, you have to have bone fusion to it, and if you have any micromovement, your body just kind of pushes it or rejects it. So it can reject it in two different ways. It can blow it out and act like it's a splinter, or it's going to create scar tissue around it and not integrate the bone into it, fixing it so that when you go long-term, 3 months, 4 months, and you check the implant just unscrews, and it's just tissue around it. So that's a huge problem. And there's another one I call hypersensitivity. It's basically an infection with a bacteria that can't be solved with antibiotics. And it usually happens with smokers and others that just kind of have really diseased mouths where they kind of have superbugs in there is what I call them. But those you just have to take the implants out because the pain is too much. Those are rare, but they do happen. And so here's the all-on-4 model. You can see this on the line. You can look at Google, and you will see the 4 implants like this is an upper arch, and then you screw that denture onto those 4 implants. And that's essentially what you get. But in the initial stage, when those implants go in, you fix that denture to those non-healed implants, and now they allow your ability to occlude or close your teeth together, which can cause the micromovement. Whether you're eating or not, this can be a problem. So there are rules for dentists to put the implants in and check and make sure that there's a certain amount of stability to those implants, but still you can't trust it because as your bone remodels, it becomes softer in the first 4 to 8 weeks. Then it becomes more sturdy and stronger bone. So during that process, your bone turning over and trying to heal and becoming softer, the implants become more mobile. And that's a very critical stage. So in that first, 4 weeks is very, very critical that you do not chew on it. But typically the pain is already gone from the extractions, and now you got to deal with that. So anyway, so here's our approach. We like to do the locator attachment approach and not fix them. I like to keep the implants below the gum line and just give a basic denture. So you don't have to worry about any micro movement, and hopefully within the week or two your tissue heals over and seals it up away from infection. So I call it a more conservative approach. It's more hygienic because you have something that you can take off and you can keep clean. You don't have the micro movement possibilities you would have, and but the denture's not fixed. That's kind of a con, and it's just a basic denture that you have. So you're going to be able to eat maybe some soft foods at best. The all-on-4 model has a higher chance, of course, of micro movement, and it's definitely less hygienic because now you've fixed a denture that you can't take off, and food is going to get under there, bacteria is going to get under there. So now you increase the rates of infection around the implants and other problems around your gum tissue. So that's a very hard thing to clean. And you're told that you could eat soft foods, but I would still not even recommend that. You're basically going to blend all your foods. So that's why, and also that's basically what the all-on-4 model is. It's a fixed hybrid denture piece that they do right at the first time of surgery. It's just a basic denture. Every dentist could do that, and it's helpful to be aware about what you're getting into when you start spending a lot of money on your teeth, especially like a full arch case. So hopefully that was helpful.